Hello, my name is Elvira Minchik, and today we'll be recording the vital signs video. Before we begin, we do have to make sure we have all of our supplies, our badge, our watch, our stethoscope, our whiteboard to record our findings, our blood pressure cuff, as well as a sanitizing wipe. Now that we have all of our supplies, we're going to go ahead and enter the room by knocking on the door. Once we enter the room, we're going to go ahead and ask our patient, introduce ourselves to the patient, as well as ask our patient to identify us. Hello, my name is Ella, and I'll be assisting you today. Before we begin, can I please have you identify your first and last name, as well as your date of birth?
Olga Versova, 0906-1994.
Perfect, thank you so much. Now that we have identified our patient, we're going to go ahead and wash our hands, close the privacy curtain. Now that the privacy curtain is closed and we have the privacy with our patient, we're going to go ahead and assess the vitals. So before we begin, we're going to make sure that our patient is sitting up and their legs are not crossed and flat on the floor. Now that we have completed that, we're going to go ahead and make sure that their arm is rested and relaxed on the table. We're going to go ahead and take your radial pulse, and by doing so, we're going to go ahead and put our two middle fingers on the radial artery. Once we assess the pulse, and it's normalized, we're going to go ahead and count for 30 seconds. Perfect. I have counted 40 beats per minute for 30 seconds, and we're going to multiply that by 2, and that will be 80 beats per minute for the pulse. The typical pulse in the normal range for a pulse is 60 to 100, so our patient's pulse is within normal range. Now I'm going to go ahead and take your pulse one more time for you. Perfect. We have assessed our patient's respiratory rate and our patient's respiratory depth. We have counted for 30 seconds, and I have counted a total of 8 breaths per minute. We do have to multiply that by 2, being 16 breaths per minute. The normal range is within 12 to 20, and our patient's is 16, so that is within normal range. Now that we have assessed that, we're going to go ahead and take the patient's blood pressure. Before we begin, we do have to raise our patient's sleeve. We're going to make sure that the patient's sitting up and their feet are placed flat on the ground and not crossed. We're going to relax the arm on the table, and we're going to go ahead and identify the brachial artery. Once the brachial artery is identified, we're going to go ahead and grab our cuff. We're going to make sure that it's the correct size for the patient, which this one is. We're going to make sure to place the cuff 1 inch above the brachial artery and make sure that the pointers are pointing towards the brachial artery. Once we have placed the pressure cuff onto our patient, we're going to make sure that it's untangled. We're also going to make sure to sanitize our stethoscope. Once our stethoscope is sanitized, we're going to go ahead and ask our patient what their typical blood pressure is, if they're aware of that. I just wanted to make sure, do you know your typical blood pressure rate?
122/80.
Perfect. So we're going to go ahead and write that down. Now that we know the patient's typical blood pressure rate and there's just her systolic being 122, we're going to make sure to pump our valve 30 millimeters over that, which will be 152. So we're going to go ahead and assess her blood pressure. We're going gonna go ahead and put on our stethoscope. We're gonna make sure to place the stethoscope on the brachial artery and make sure that it's not touching the cuff. We're gonna release the valve counterclockwise all the way, and then we are going to pump to 152, above our 30 millimeters above our patient's typical 122 systolic. Our patient's blood pressure was 120/80, so we're going to go ahead and document that. Our patient's typical blood pressure is 122/80, so her blood pressure is within normal range. Now that we have completed that, we're going to go ahead and take off the cuff. We're going to go ahead and place the patient's shirt back down, and we're going to ask the patient if they have any further questions. Do you have any further questions or concerns? Perfect. So now that our patient has no further questions and concerns, we're going to go ahead and exit the room, and before exiting, we are going to wash our hands, and that's it.